Good evening, everyone, and we would like to welcome you for the webinar. This is entitled Lifestyle Medicine for Me and My Family. So this is a free webinar that we are offering in this platform. Before we proceed, let me introduce myself. I am Dr. Michelle Palma, and I'm the director of this CULINARY MD platform. So this webinar is offered to our participants, to those who are just interested to learn more about lifestyle medicine, who wanted to improve their medical condition, utilizing their lifestyle medicine changes or lifestyle modification. They may be needing some counseling, they might be needing some coaching sessions, and so that's what you can find in this platform. Now, as you can see in here in the screen, this is the usual prescription pad that you will receive whenever you pay a consult for your physician. And in lifestyle medicine, what usually appears in our prescription pad is, in fact, lifestyle interventions that utilizes nutrition, physical activity, stress reduction, sleep health, and some more modalities that we use in lifestyle medicine. So in here, this is the slide that we will be focusing at this evening. And as you can find here, these are the top 5 causes of death worldwide. This was published by the World Health Organization. And as you will see here, number 1 actually is cardiovascular disease. And then included here is respiratory disease, cancer, diabetes, and stroke. Now, in the Philippines, cardiovascular disease is the number 1 killer. Number 2 is turning to be cancer, and stroke is turning to be the number 3 cause of death. Now, what's familiar and what's common between 5 causes of death worldwide is, in fact, all of these are lifestyle related. So when it is lifestyle related, that means it's modifiable. We can do something to prevent them. We can do something to manage them. We can do something to arrest and even reverse some of these chronic diseases as to some extent. So that is, in fact, a very good news because, like, for example, for diabetes, there are more and more evidences coming out right now that we can exactly reverse the condition. As long as the pancreatic cells are still, the beta cells of the pancreas are still working and producing its insulin. And as you can see here, cardiovascular disease, or we're talking about coronary artery disease in particular, there are many, many more evidences showing that we can actually reverse the plaques that are narrowing the blood vessels. It may take a little while, but the good news is that we can do something else instead of having into surgery, because not all patients are actually good candidates for surgery. Some people may be able to afford the surgery, but it's just that they cannot be cleared for surgery. And so lifestyle medicine is, in fact, one of the intervention that is now being utilized not only in the Philippines, but worldwide. This has started in the United States. In fact, all the evidences that we're using right now are based on the research that were conducted in the United States. And so right here in the Philippines, we are adapting those protocols, those guidelines that were already set up for lifestyle medicine intervention. Now, as you can see here in this news, this was published in the Manila Times in April 14, 2018. It says 1 in every 4 Filipinos are hypertensive. Now, as you would realize, not all Filipinos are really practicing a regular consultation or regular checkup with physicians. Not everyone, and it's not really culturally practiced in the country, that people will get to regular physical examination or regular consult to a doctor. So what I'm trying to tell you here is this statistic may be higher. So if it says 1 in every 4 Filipinos, then I may say maybe it's a little bit higher, because there are more hypertensives out there that are not being diagnosed at all. So here, the next, you know very well, the stroke is the number 3 cause of death in the country, and hypertension is, in fact, the highest, one of the highest risks. So this is the 3rd cause of death, and there are about 300 Filipinos who are at risk of having stroke each year. And you will know that it's not really easy to have a patient who have stroke, and we know very well that this can be prevented. And so it's really better, and it would really be nice for us to talk about prevention of stroke rather than just managing stroke, specifically if the patient um, um, if the patient had residual weakness or paralysis after having stroke. Um, Here, this is a one of the most significant findings that we have right now in the Philippines, because just recently Philippines was declared to be having an epidemic in diabetes. And so you will find here in this slide that it says 1 out of 5 Filipinos are in fact either pre-diabetic or already diabetic. Now, as much as I wanted to discuss more about diabetes, but this is a 30 minutes webinar that we're having. We will be talking about few things about diabetes, and in fact, this is one of the cases in lifestyle medicine where we're really successful in dealing with, because diabetes is primarily lifestyle related, and it can be controlled by the calories that we are taking. Now, you will see here that you don't need to be full-blown diabetic for you to suffer from the complications. And so that's why right now we take care of people having pre-diabetes, because complications already start at pre-diabetic stage. Now, in fact, in the United States, 1 in every 3 Americans are already at risk of having diabetes. This number we have in front here is not actually that far from the statistics that Americans have. And so in the country right now, 1 out of every 5 Filipinos are at risk of having diabetes or pre-diabetes. Now, it doesn't really follow whether you are at early adulthood, or you are at your elderly stage, because diabetes are actually affecting both young and old this time. So diabetes primarily is a problem of patients who are taking too much of fat and too much of refined carbohydrates, so rendering their body to be ineffective in dealing with the carbohydrate load that they have, and then starting off with insulin resistance, and then less of a physical activity, and then so on and so forth. Now, this is one bad news that we are facing right now in the Philippines. This was published and was released by the Philippine Obstetrical and Gynecological Society, and they were showing that Philippines has the highest prevalence of breast cancer among 197 countries. Now, this is not really a good news, because we're on top in terms of producing breast cancer patients. Now, in lifestyle medicine, we are starting to see that cancers are starting to be a DIY disease. That means you do it yourself. You treat yourself. It's really something that we eat, something that we drink, what we work, where we are exposed at, things that we do every single day, and then the routine that we have, the exposure that we have, and of course the family history that we have may determine whether we will become a cancer statistic. Now, this is really one of the callings that the Department of Health is having, because they were trying to find out that 1 in every 3 Filipinos will practically die from non-communicable diseases. So this is very unfortunate for patients, because non-communicable diseases are chronic diseases. So most of the time you won't really feel anything, you don't feel bad at all, and so we continually indulge to the causes, of the chronic diseases. Say a patient with diabetes wouldn't really feel anything at the onset of the disease until complications starts. And then patients with hypercholesterolemia don't actually feel anything until hypertension sets, and then they got to feel dizzy, and that's the time they go to the doctor, but the condition actually started way ahead. And so since this is chronic disease, patients are not totally aware that there's something wrong until until they get into the laboratory and find something wrong with their blood works. And so right now, the Philippines is suffering from the double burden of disease. So that means Filipinos are suffering from both the communicable disease and the non-communicable disease. And right now, the non-communicable disease are starting to increase in terms of percentage, in terms of incidence and prevalence. So, well, we know very well that non-communicable disease or chronic diseases are actually preventable. They can be managed, they can be arrested, and at some point they can be reversed as well. And so that's the point that we're trying to imply here in this webinar. So definitely the country right now is in a perfect storm in terms of non-communicable diseases. In this next slide, I wanna let you see the algorithm that the physicians are using when we manage patients, say for example with hypertension. I'm not expecting you to understand all of this thing here, but I just wanted to emphasize things that are related to lifestyle modification. So say for example, this is the algorithm that we use when we treat patients with hypertension. So what you will find here at the upper box, as you can see. Now, when it says it's the upper box, this is the first thing that we are supposed to do. So this is the JNC8 hypertension guideline algorithm, and it says here any adult aging 18 or more years old with hypertension, number one here is to implement lifestyle modification. So lifestyle medicine is in fact in the algorithm or in the treatment guidelines. Now this guideline is in fact for atherosclerotic cardiovascular disease, and this is adapted to American Heart Association and then American College of Cardiology, and you will find there the lifestyle management guideline, because as you can see at the upper box, so it's the heart healthy lifestyle habit that is the foundation of atherosclerotic cardiovascular disease prevention. So when we say atherosclerotic disease, so this means hardening of the arteries. This is narrowing of the arteries. Okay. Now, this is management for obesity. So this is adopted from the American Heart Association and American College of Cardiology and the Obesity Society. This is how we manage patients with obesity. So you can see here with the things with the red arrows that all of these things are talking about lifestyle changes. So like here, for example, this is lifestyle change, this is comprehensive lifestyle intervention. This is another intensive behavioral treatment. And then this is another high intensity comprehensive lifestyle intervention. So it's still included in the algorithm. And then this is one of my favorite. This is the glycemic control algorithm here, and this is what we use in managing patients with diabetes. So here it's really so clear that regardless of the treatment that you may give your patients, because initially when a patient comes and then we diagnose them with hypertension, with diabetes, I mean, so we usually start with monotherapy. We start with one drug, and then eventually if the patient doesn't respond, the medicine doesn't seem to work on them, and then we started with dual therapy, and then sometimes depending on the case of the patient, we go for triple therapy, and eventually we end up giving insulin to patients. All right, but regardless of the type of treatment, as what you can see up in here, lifestyle therapy in fact is the key. So this includes medically assisted weight loss. So depending on the progression of disease, you can see here that lifestyle therapy in fact is included in the management. Now, regarding cancer, this is adapted from the American Institute of Cancer Research. You will find here all cancer prevention recommendations. Doesn't talk about any medications at all. So it talks about healthy behavior. So it starts with maintaining a healthy weight, talking about physical activity, moving more and less of a sedentary lifestyle, eating very well, mostly whole food, plant-based diet, decreasing consumption and avoiding processed meat, cutting down of alcohol, eating less of the salt, so on and so forth. So these are all lifestyle modification. Now, one question that you might be asking, why not all physicians are giving counseling in terms of physical activity, in terms of nutrition, or I mean in general, why are they not giving lifestyle modification strategies or program to patients despite the need? You know, now in this slide, you will see that there are a lot of barriers to counseling, and this is, in fact, for physicians. Number one, because we lack time. Like for example, if you are lining up outside, you know, waiting for your turn to a physician for a physician's consult. So you're in a queue and there are about 30 or 20 or more patients waiting in the line. Then of course, how can a physician even spend counseling, you know, to patients? So it would eat up a lot of time, and so that's the number one concern. They don't have time. And then there is also reimbursement issue, because not just in the Philippines, but outside the country, reimbursement is always an issue in terms of counseling, because of course a physician will be spending time with you, and of course they would need to be compensated, you know, in terms of giving the service. So that's one of the barriers as well. And then the next are the most important aspects of as barriers to counseling. Physicians are not has no sufficient confidence actually, and confidence starts with knowledge and then the skills. So if physicians don't really have knowledge or sufficient knowledge in counseling patients to lifestyle modification, they will never develop the skill. And when they don't have the skill, they will never be confident in doing counseling. So the reason being is that lifestyle modification and lifestyle medicine counseling is not included in medical school curriculum as we speak. So, in fact, in the Philippines, there is only one university that is integrating lifestyle medicine in the medical curriculum, and that is the Adventist University of the Philippines. But we're looking forward that more and more universities in the country will be adopting lifestyle medicine in the medical curriculum as well as a initial benchmarking in introducing lifestyle medicine to medical students. So that's the very reason why physicians are not able, you know, to deliver counseling and lifestyle medicine intervention to patients despite the need. Okay, so in fact, with all those things that we've been talking about, we talked about the top 5 causes of death, and right now worldwide, we are seeing that about 70% of the cause of death are all lifestyle related. In fact, what happened was in 2010 in the United States, all of these societies, as you can see in the slide, the Blue Ribbon Panel on Physician Lifestyle Medicine Competencies was formed, and they were able to create and agree what definition is supposed to be for lifestyle medicine, because lifestyle medicine is separate specialty that is really existing right now, plainly managing patients with lifestyle diseases. So they were able to create the definition, and they were able to identify 15 lifestyle medicine core competencies for primary physicians. And then this was finally published on July 14, 2010 at the Journal of American Medical Association. So it was stated there, the 15 lifestyle medicine core competencies that should be utilized by primary care physician. So here, when we say lifestyle medicine, these are the basic definition. So the simplest one is the use of lifestyle intervention in the treatment and management of diseases. So this is the definition that we get from American College of Lifestyle Medicine. So we have a detailed definition here, and this you can find this in one of the textbooks that we use in lifestyle medicine. It is the application of medical, behavioral, motivational, and environmental principles to the management of lifestyle-related problems in a clinical setting, including self-care and self-management. So these are the lifestyle intervention modalities that are being utilized in lifestyle medicine. So basically, we talk about nutrition, And this is where culinary medicine would come in, because as you can see in all aspects in lifestyle medicine, nutrition really plays one of the huge role. So next is physical activity, and then we have stress management, emotional wellness. We deal about sleep hygiene, and then we talk about smoking cessation and other substance use. And we also have some non-drug modalities that we use in lifestyle medicine. But ultimately, we give emphasis on behavioral interventions and social relationships, and including happiness, right? So because health is in fact should be a holistic health as holistic component. Health is not only nutrition, health is not only physical activity, and it has a lot more. Okay. So usually in lifestyle medicine, what we usually do is having shared medical appointments. What you can see here, um, we don't only deal with one single patient. So like, for example, if I have 5 patients lining up in there, all of them are diabetic patients, and so I have to do counseling for one patient, and I have to do the same counseling to another patient. Now that doesn't make sense at all, because you cannot repeat the same things over and over again. So tendencies are, I will be really good in doing the counseling for the first, second patient maybe, but in the third, fourth, and fifth patient, I may be giving just 50% of what I did for the first 2 patients. So there is this what we call SMA, or shared medical appointment for patients. Sometimes we call this group visit. And so we group patients that are diabetic, and then we discuss their condition, and then we have lots of activities that we do in shared medical appointments. Usually this will take about 3 hours. So we will have different sessions in the span of 3 hours. And then these patients will be able to have a group support as well, with patients having the same condition. So we use SMA in clinic setup. We also use this in hospital-based lifestyle medicine practice. Now, what we also do in lifestyle medicine is to engage patient into healthy practices. Apart from having the shared medical appointment, we usually let them visit gardens, and then this is included in the SMA activity. It really depends on the activity and the schedule that we give to patients. We usually visit health food centers, sources of healthy goods, that they may have in the community. So this is just one of the example of lifestyle medicine program that we have. This is in Bacolod Adventist Medical Center, and these are our patients enrolled in SHIP, or Complete Health Improvement Program. So this program actually run for 30 days minimum, to 90 days all in all. So we have different activities in this program. So you can also find CHIP. You can also search this in Google. Just search Complete Health Improvement Program, and you will see a lot of resources in there. Now, lifestyle medicine is also brought in the community, and so it's really amazing, and it's really it's surprising right now that wherever you go, whether in the mountains or in the urban areas, um, most people are suffering from non-communicable diseases. So what you can find here, this is a community of indigenous people, and I was really surprised, because as we assess patients right there, people there are suffering from the same diseases that people are suffering in the city. So their lifestyle has changed a lot. They forgot some of the culture, most of the culture that they have in terms of food preparation, in terms of food preferences. They love processed food up there. So what they do is they produce what they are producing, like they produce vegetables, and then they sell it in the market, and then after selling them, it's now a money, and then they would buy noodles, they would buy canned goods, and that's what they bring up there in the mountains, and that's what they eat, that's what they sell right there. So of course, people who are changing their culture, changing their lifestyle, would also change health conditions and health outcomes. So just like Filipinos, we tend to forget most of the cultural practices that we have in terms of diet. We are mostly eating Western type of a diet. We call it the standard American diet. And so this is what we always say, that Filipinos are talking like Americans, we live like Americans, we're eating like Americans, and so we're dying like Americans. So the moment, and it was proven in many different researches, and it was there in many evidences already, that whenever a patient, whenever a different culture or a different a different culture and a different ethnic group would adopt standard American diet, they will have the same statistics, they will have the same diseases that Americans are dying to. So that's it. And here we also bring lifestyle medicine to many different offices. We call this a corporate lifestyle medicine program, and we also have lifestyle medicine introduction to children. So as going back to the topic that we have for today, it's supposed to be lifestyle medicine for me and my family. So as you can see here, lifestyle medicine work initially with the children. In fact, it would really be nice for you to join upcoming webinars. We will be announcing it because we want to talk about the first 1,000 days of life, and that is the crucial period where mothers and parents have to take care of children because they are influencing the genetic makeup of their children. Okay, so their diet, in particular, their lifestyle will affect, the expression of the genes, and we call it the epigenetics. So that's another topic that we will deal and we will explore later on. We're just trying to emphasize here and to introduce to you here that lifestyle medicine works for children, for adult, and for elderly. So here, this is a program that we did in one school. We started with introducing plant-based diet to children instead of eating processed food, instead of serving noodles to children. Now we introduced here planting of vegetables, and so they were able to harvest their own produce and then prepare them in such a way that children would enjoy consuming whatever they produce. Now, this is also introducing lifestyle medicine and culinary medicine to culinary art school. Now, what we're trying to notice right now, you see in many hotels and many different resorts, there are a lot of patients who are into vacations, and then these patients would ask for a special meal for them. Say, for example, I'm a patient with cancer and I would need diet for cancer. Like I'm a patient with diabetes, hypertension, so on and so forth, and I would need such kind of a diet for me. And since this is not being taught in culinary art school, so these chefs are actually in a dilemma in preparing food for such type of guests that they have. And so now we are starting to introduce culinary medicine also in culinary arts because of the eminent need that we are seeing. So now in the Philippines, currently would like to introduce to you the lifestyle medicine clinical departments that we already have. So we have one in Adventist Medical Center in Bacolod. There is also a lifestyle medicine department at Adventist Medical Center, Manila. And one more here is Antique Medical Center, and more hospitals actually are developing their own lifestyle medicine clinical department as well. So lifestyle medicine education also is into public health. So now the Adventist University of the Philippines is already offering a master's degree in public health, majoring in lifestyle medicine. So lifestyle medicine actually is not just looking at the health of your family, but looking at the health of the entire population. Why is it that diabetes right now is so rampant in the Philippines? Why are we declared to be having epidemic in the Philippines? What's wrong with the community? What's wrong with the food consumption? What's wrong with the medical system? That's how people in public health look at the because doctors really look at patients. I mean, we doctors, we look at the diabetes in the patient. Now, in public health, they think outside the box. They would see many other details that we physicians are not able to see. So that's why lifestyle medicine also is already in masters in public health. Now, in fact, in 2018, this is the first Philippine Lifestyle Medicine Conference that was funded by the PCL Legislative Academy. So this is funded by the Department of Interior and Local Government. So we had this conference for government physicians. We had this conference for for the counselors who are head or the chairman of the health committee that they have in their locality. So these are attended by policymakers, attended by government physicians, and just so for them to be informed what lifestyle medicine is all about, and then to strategize any program that they may have in their community. And so why the policymakers are there, so they will be able to understand what type of policy they are to make to support the program that these physicians are doing in the community. So we're looking forward to another event such this that will engage more physicians and at the community level, specifically government employed. So in fact, this is one of the city ordinance that was already this is the result of that conference in 2018, that in 2019 one of the councillor was able to pass a city ordinance establishing healthy lifestyle campaign in all barangays, and this is in Bacolod City. So we're looking forward to more and more programs and ordinances like this that will come out in the future. And this will be intensifying promotion of healthy lifestyle to prevent and control non-communicable diseases utilizing lifestyle medicine intervention. So now, let me introduce to you the existence of culinary medicine. Why do we have culinary medicine? Is this a practice that is recognized somewhere in the world, or is this culinary arts or something else? Now, as you can see here, I already introduced in the first slide, you will find there the RX sign. So I'm not sure if all of you are familiar that the real meaning of RX sign that you will find in the prescription pad that physicians would use like me would mean recipe. Yes, the original meaning of RX in the prescription pad that we use is in fact recipe. So that's why culinary medicine in fact is a combination of the art of cooking and the science of medicine. So generally culinary medicine is not really it's not really in the preparation, it's not really on the skill of preparing the food, but this is the skill of cooking food for health, which is with the goal of restoring health and managing chronic diseases. And if the goal is to reverse certain chronic disease, like for example heart disease or diabetes, then we have a customized program in culinary medicine for specific type of diseases. That's why in culinary medicine the modules are actually specified. Like we have modules for diabetes, we have modules for heart disease, we have modules for kidney disease, for liver disease, so on and so forth. So as you can see, we have here the blending of medical science and food preparation or cooking. So in culinary medicine, we have two types of courses. We have the public classes that is open for everyone, whether you are a patient or you may be taking care of a patient suffering from chronic disease. This public class are open for you. Now we offer them seasonal. So like for example, this month we are offering 4 public classes. These are short courses that we have. So we also have the full certification course, which you can find more in the website. So just look and browse at the website and you can find more details about it. Now, this is just a journal that we want to present to you here, talking about culinary medicine. Now, this is bringing healthcare into the kitchen. Now, we wanted to introduce to you how learning in the kitchen is possible. So we are encouraging people to cook more in their houses and eat whatever is prepared in the house, because more and more people right now are eating out. They spend more eating out, and we know very well that the moment we eat out, we're consuming much of calories because we cannot control the preparation of food. Yes, we may have best choices when we eat outside, but really food preparation in the house is necessary when we are talking about reversing diabetes, or when we're talking about reversing heart disease, or when we're talking about having a cancer patient in the house. So the best option really is to prepare food. But the problem is whenever we are able to convince a patient to engage into a healthy diet, the next problem is, how do we prepare the food? What kind of food do we eat? Because there seem to be a lot of restriction already, and they may tell you there's nothing left to eat anymore. And so the number one um, aspect to be addressed, in fact, is food preparation, because you can never sustain a healthy lifestyle with a dull preparation of food. It has to be tasty, it has to be palatable, and it has to be delicious, and it has to be prepared in the same manner that you usually eat your food and enjoy your food. And so that's what culinary medicine is bringing in here. So culinary medicine basically is not veganism. So yes, um, whole food plant-based diet is the main essence of culinary medicine, but we're trying to emphasize here that culinary medicine is not veganism. Because you might be vegan, you might be eating all plant-based food, but they may be all processed. So that's why we always say you can be vegan, but you can have heart disease too. You can be vegan, but you can have cancer too. So that's why when we talk about optimal diet, we're referring to whole food, plant-based produce that we are consuming, and these are grown seasonal, and these are prepared in the simplest way possible. So for us to retain the nutrients, and then we also talk about the proper timing on how you consume the food, because you might be vegan and you might be eating plant-based diet all your life, but you can be obese too, because you might be eating very little of your calorie in the morning and then eating the rest of your calories at night. So you'll be storing such calories, and your blood sugar will increase as well, because you're not using the calories, because you just have to sleep after eating at night. It really depends, and there are so many factors that you have to consider in terms of food preparation, in terms of food consumption, and then the choices of food. Because in culinary medicine, we don't really want to emphasize on calorie counting, because whenever you eat whole food plant-based diet, calories are not really your problem. I mean, you cannot overeat whole food plant-based diet, but you can always overeat and I mean consume too much of a calorie whenever it is processed. Just like, for example, when you eat one tube of Pringles, this can give you about 1,000 calories already. And for you to be able to consume that 1,000 calories from a whole food potato, then I know you have to consume a lot of potatoes, and we're talking about 5 to 10 potatoes depending on sizes. You cannot finish those 5 and 10 potatoes in just one sitting, but you can finish the entire Pringle tube in just one sitting. That's already 1,000 calories. So that's how it works so far, in culinary medicine, and that's what we talk about. Now, in dealing with chronic diseases, we always deal about consumption of food in terms of culinary medicine. And then, of course, a lot of other modalities would play a role, like physical activity, having no sedentary lifestyle. And then, of course, we talk about stress, we talk about binge eating here. That's why we have culinary medicine counseling or culinary medicine coaching, I mean. Because in culinary medicine coaching, we use the upstream method, and the upstream approach in dealing with the cause of disease. Yes, it's good to know the cause of the problem, but what we deal here in coaching is we dig deeper. What is the cause of the cause? right? So just like, for example, this patient is really suffering from heavy weight, and the problem is really binge eating. So we don't just address the binge eating, we address why the patient is having binge eating. So that is going deeper, one level further, and so we would address the cause of the cause, right? So that goes with culinary coaching. Culinary coaching also includes preparation of food. How do you plan out your food? Because for you to be able to remember the food that you've eaten for the last week, it's difficult without planning, you know. And then if you are now working on a patient with diabetes, or working on a patient with heart disease, or working on a patient with different types of chronic diseases, of course you have to plan out something. We're not only talking about managing patients with chronic disease, but we are talking about preventing. Like, I have to prevent having heart disease. I have to prevent my family from having those kinds of diseases, because I know these types of diseases are already existing in my family line. All right, so basically that is where culinary medicine is coming into the picture. So what we say, culinary medicine pairs the art of cooking with the science of medicine. So here, the objective is to educate about the powerful influence that food has on health and disease, and through the hands-on cooking classes, teaching skills for preparation of meals with nutritional health benefits towards preventing, managing, and reversing chronic disease. This might be an online course, but you know, as you go along the course, you will be required to you know, you are required to finish a task, and that task is really entails hands-on activities. I mean, you have to prepare your own food. You will never learn when you don't get your hands into the kitchen, and so you deal with preparation of food. So included in the lesson is culinary skills, and then your food preparation. Okay, so clearly, let me just emphasize here that culinary medicine is not a gourmet cooking. It's about teaching the why and the how behind the low-cost, convenient, health-promoting, delicious home-cooked meals, and that's what we always emphasize, and of course we deal with the healthy eating patterns. So culinary medicine plays a huge role in lifestyle medicine. And in fact, this is the very first thing that we deal with in terms of lifestyle modification. And I know that's, you're all already familiar with that, because whenever you go to a physician, the next thing patients would always ask is, Doc, what are the foods that I can eat and what should I avoid eating? You know, so that is already the usual instinct right now, and that people are already ready, and people are already aware that what they're eating are somehow causing some of the mischief that they are suffering. All right, so I'd like to invite you for the next coming webinar that we will have, because as you can see, I've already discussed in the first slides that I presented to you that heart disease is the #1 killer. It's the top killer in the entire world. It's the #1 killer in the Philippines since the year 1990. It never went down. It was still it is still the first and the top killer in the country. So if 200 Filipinos are dying every day of heart disease, you don't want to be the next one. You don't want to be included in that 200 people dying every day. I don't want to be included in the next years to come either. So but these numbers are telling us that we are at the risk of dying from heart disease, and we're not, no one is exempted, in fact, whether you have or you don't have family history. So the next thing we're going to learn here is how do we prevent and how do we avoid having ischemic heart disease? How do we avoid having coronary artery disease? And how can we avoid having heart disease totally? Now, we will be dealing with cholesterol, we'll be dealing with fat intake, we'll be dealing a lot more about food preparation, we'll be dealing about physical activity. There are a lot of questions going around saying, I'm a sporty person, I play a lot, I'm an athlete, and so I am I can eat whatever I can, because you know, I'm burning the calories, and whenever I exercise, I'm still burning. I'm burning it, and there's nothing left in my body to be stored. And that's what they're thinking, but it's not really true. And we will explain that in the next webinar that we have. So that is heart disease, which is the top killer. So ladies and gentlemen, would like to thank you again for joining our webinar. And we're inviting you to browse our website and look at some of the modules that you might be interested about. We are really introducing to you our seasonal short module that is really customized for this holiday season. So we have an upcoming module called How Do You Maintain Your Blood Sugar, especially during holidays. And then the next coming module is how do you maintain your cholesterol during holiday treats. And then next is we'll be talking about colon cancer and how do you cleanse your system after eating so many things during the party days for the entire month of December up to January. And that's what we're looking at. How do you prepare foods that will help your body detoxify? And then lastly, the next seasonal module that we released, we will is improving your microbiome through anti-inflammatory diet, because for sure this December we will be eating a lot, and we think this is cheat days, and cheat days is never just one day and another day is coming, and sometimes you can't say no. So we have to work on it. We have to help our body regenerate, and not just consuming things that we want, but also helping our body get rid of the toxins that we're eating as well. So not just the toxins, but it's talking about the sugar, it's talking about the cholesterol, so on and so forth. Check out our website. So it's culinarymd.com, and you may find there some of the modules that you may be interested, and you can always get back to us. Our team is really ready to answer your questions, and they are ready to help you out. So again, thank you for joining our webinar, and we hope to have you again in our next in the next webinar that we will be posting. Good evening, everyone, and have a healthy day.